Please welcome our third speaker today, Elizabeth Wells. Elizabeth is an enthusiastic researcher, librarian, and former teacher, passionate about developing a love of reading and learning in others, improving literacy, and promoting the value of reading and libraries to the community. During her decade working in public libraries in central Victoria, she noticed a frequent correlation between undergoing cancer treatment and losing the focus necessary to read for pleasure. Elizabeth has undertaken a PhD to explore how reading aloud to cancer patients undergoing treatment might influence emotional well-being. Prior to moving to Adelaide to undertake this research, at a time when libraries suffered COVID-related closures, she worked in palliative and aged care. As a cancer survivor herself, she is able to empathize with her research participants. Elizabeth has been speaking at cancer support groups around Adelaide, and in recent weeks has appeared on television and radio to discuss her research. So over to you, Elizabeth.
Thank you, Deborah, and thank you everyone for inviting me today. My name is, Deborah said, Elizabeth Wells. I am, as you know, a PhD candidate at the University of South Australia. Cancer-related cognitive impairment, or CRCI, is an important part of my research. I'm finding this research really exciting, and I have a team of great supervisors here, and I am grateful for the opportunity today to talk to you, so thank you. So cancer-related cognitive impairment, or CRCI for short, it used to be known as chemo fog or chemo brain. But now that we know more about it and who gets affected, we generally call it cancer fog or brain fog now, which we'll talk about as we go along. So doctors and scientists have made great strides in developing new treatments for cancer, but cancer-related cognitive impairment still remains a bit of a mystery. So who can get CRCI or cancer fog? Some of you watching and listening today may be experiencing it. CRCI's commonly reported occurrences affect more than half of cancer patients during and often after chemotherapy, targeted therapy, hormone therapy, immunotherapy, all the therapies that are in the cancer domain. The prevalence of CRCI varies according to different studies, each looking at different types of cancer and different types of treatment, with the most frequent occurrence seen at 75% for breast cancer patients who received chemotherapy. The studies I'll reference today are from a variety of cancer types. CRCI can present in a number of ways, but it's commonly experiencing difficulty with concentration and processing. So in real life situations, that can mean trouble reading, driving or navigating, difficulty finding the right word during a conversation, or just keeping up with conversations. People can also struggle with multitasking, feeling confused, forgetting names or dates or things that you'd normally remember. You might struggle to learn something new or just feel terribly disorganized, as though you're just struggling with normal day-to-day things. So the most impaired cognitive functions are attention, memory, processing speed, and executive functions, which are organizing, multitasking, planning, and motivation. Okay, if only it were this simple, there is no effective test. We haven't found a test yet to screen cognitive abilities with high enough sensitivity and reliability. So looking at the two pictures on the screen, the picture on the left is someone doing a test in a quiet environment. They're sitting by themselves, there's no distractions around. So in that situation, they can perform pretty well. But real life is more like that picture on the right. There are other people, there are noises, there are distractions, there's busyness. And those are generally the situations where this cognitive impairment is felt at its worst. Not necessarily a shopping centre, but just real life where there are other demands, where we're not just doing one thing quietly at a time. So health professionals have tried using standard cognitive tests, but they're just not subtle enough to make diagnosis. So exact causes of CRCI are not known, but recent studies implicating the body's own tumour response now. So tumour development can possibly, sorry, I'm starting again, I'm not a public speaker. So the body's response to tumour development as a cause, and that's only worsened by receiving treatment. So there was a study recently where a group of mice were given breast cancer and their cognition was tested, and they were found to be impaired from the time when they were healthy to the time they had the breast cancer. And then when they gave these same mice chemotherapy, it was found their cognition was affected even further. So 3 separate brain changes have been identified as possible causes. So there's inflammation in the brain's nervous system resulting from the body's own attempt to stop the tumour growing. There's the production of new brain cells in the regions associated with memory that are limited by chemotherapy drugs. There's the combined effects of chemo and tumour development that diminishes the learning and memory regions of the brain. We know this. But there are only some possible causes, and all treatment types, and even cancer without treatment, as we've said, have been looked at for different ways this impairment might occur. So looking at this next slide, I know there's lots on the slide. It looks a bit blurry actually, but hopefully you can see enough. So these are all possible mechanisms for CRCI. So looking at myeloma, the typical treatments are, chemotherapy, stem cell treatments, radiotherapy, and now immunotherapies. And you can see there are a few theories about why this is happening with those treatments. So aside from those ideas as well, there's also patient-related outcomes as well. So general health status, level of distress. There is a link between distress and cognitive impairment as well. Some studies are looking at genetics as well. So there are people getting CRCI, and lots of them, during treatment, but there's also a subgroup of patients who experience a delayed onset of cognitive impairment too. So this figure's from a study that was done last year. So if anyone would like it, just get in touch with me later. The good news though is that, from the other slide, the impairment is usually temporary. But how does CRCI impact people? First and foremost, it's frustrating. Imagine all those impacts: trouble navigating, driving, forgetting things. Frustration is a natural result, and ongoing frustration can affect your self-confidence, your quality of life, potentially your ability to self-care. You may be forgetting things. In the workplace is another kettle of fish. I spoke to a lady recently and she thought she would get sacked because she knew she wasn't performing at her normal level while she was going through her treatment. But of course she wasn't, they're not allowed to. And she did tell her boss why she was struggling, and allowances were made, but she was feeling inadequate. So that can affect workplace relationships and just her level of satisfaction with herself. Likewise, other relationships that we have in our lives can be affected as well. And this is exhausting as well, this level of confusion, the fatigue that is a very common accompaniment to CRCI. And all this can take an emotional toll. So as I said, it is usually temporary. It does get better with time. And most people say they notice improvements within the first year after finishing treatment. Other people do experience longer-term effects. So what's actually happening in the brain when this is going on? Anecdotally, it seems that in years gone by, doctors didn't believe, or they downplayed patients' claims of cognitive impairment. Even when patients reported they couldn't read, they couldn't remember words, they couldn't make decisions. More recently, though, research has been able to demonstrate some physical changes that can occur to the brain as the result of treatments, with chemotherapy being the worst. And the changes are principally to the frontal areas of your brain. And in the picture, that's the big tan section on the left, but it's in the front of our heads. And this frontal area is the most common region for injury in traumatic brain injury. And so from that, we can see that how important it is, that part of our brain, for expressive language and for managing high-level executive functions like organising, planning, and motivation. Also, memory and attention. I'm going to mention the temporal lobe now while we've got this picture up. And that's the bit darker brown section in the picture. And it's running lengthwise. There's one on each side of your head. They sit behind each ear. So they're used for processing auditory information or things that you hear, and also for the encoding of memory. Ways to cope. Use basic organisational tools like a diary, sticky notes, reminders on your phone. Always put your keys in the same place to avoid the frustration of forgetting where you left them. And don't be embarrassed to use ideas like this. They're strategies that will help during this time. Studies have shown that physical exercise has many, many benefits during treatment time and afterwards. The benefits are not just physical health, but also mental health. And some benefits are specific to helping with CRCI. But with myeloma, of course, check with your treating team first before undertaking any new exercises. That's really important. There's actually a really good fact sheet about exercise in myeloma on the Myeloma Australia website too. And mental stimulation. If you can read, it's great to do. If you can't, keep listening here, and we're going to talk more specifically about that in a minute. Do crosswords or word puzzles if you enjoy them. Keep learning a new language if you were learning one, or playing your musical instrument. Do Sudokus if you like them. But don't torture yourself by saying things like, oh, I must do a crossword each day to help my CRCI. Because if you don't really like crosswords, that's no good. It's important to do something that you enjoy, otherwise you're just going to get more frustrated. Meditation in cancer patients has been shown to improve verbal memory, short-term memory, and processing speed. So that's something to consider. Then there are a couple of possible drug options for CRCI, but there's been mixed results, and that is something to chat about to the doctor. Likewise, cognitive rehabilitation and training may be an option, but again, that's a chat with your doctor about those ones. You might come to recognise the things that you have trouble with more than others. For example, you might find you're especially having trouble with navigating. So don't put yourself in tricky navigational situations. If you have to go somewhere potentially confusing, get someone else to navigate. And sometimes you just need some normality. Tell your friends what you're going through with your CRCI. One lady told me that her cancer fog made it impossible to go out with her friends in a group and contribute to their conversation because she just couldn't keep up with the conversation. So going out one-on-one was easier for her, or going out with the group, but choosing to sit back and listen and just enjoy being with them. And she had told them ahead of time and they understood. So please experiment with the things that work for you. There are studies going on at the moment about CRCI. Scientists are on the ball with this now. And there has been a number of theories about why some treatments are penetrating the blood-brain barrier. For instance, the cell size of chemotherapy theoretically shouldn't get through that blood-brain barrier. So now some studies are looking, for instance, at gut health, which we know takes a beating during chemotherapy, and it's thought perhaps that because the gut is so upset, it's sending out inflammatory markers into our bodies, and it is affecting the blood-brain barrier. It's making it less effective, and thus chemotherapy drugs are getting through where they shouldn't. Potentially, this is all theory at the moment, and scientists are investigating. And we're looking at all the treatment types as well. As scientists are considering genetic biomarkers and their effect on neuroplasticity and ability to repair. I went looking for some resources to recommend to you. I'm a big fan of cancer councils in Australia. I think they do a great job with everything from having experienced nurses available, but of course you have your own wonderful myeloma nurses. But they also are great for your loved ones to call and chat to. They fund ongoing research and provide lots of resources. There's a link for the Cancer Council on the screen at the moment. It's a podcast. So Julie McCrossen, she's a cancer survivor as well. She does a fantastic podcast on cancer fog. And if you scroll down past the transcription of her podcast, there are amazing links to other fact sheets and webinars. And also, if you have a look at the Myeloma UK website, that has some really good information and further links. But tell your doctors and nurses that you're experiencing this. So talk about it at a support group if you have one. Get tips and share tips with others. Remember, you're actually going through a lot at the moment and you're doing great. So remember, this will pass. Nobody can predict how long it will last. So please make some time to do the things that you love. Stop and smell the roses, pick some daisies, but please be kind to yourself at this time. But why am I here today talking about cancer-related cognitive impairment? Why am I so interested? So I worked in public libraries in central Victoria for a number of years. And during this time, I noticed a pattern emerging of some of my regular readers who lost the ability to focus sufficiently to read for pleasure once they were diagnosed with cancer and undergoing treatment. So now I'm here in South Australia looking at why that might be the case and what we can do about it. We know there are so many health benefits to reading, but we also know reading can be impacted by cancer-related cognitive impairment. So I'm interested in finding a way to restore these known benefits of reading to people undergoing cancer treatment. And given we know about the areas of the brain most impacted by CRCI, I'm exploring the idea of listening to stories rather than reading to yourself. There's no research currently on this. So the term given to this idea of reading for therapy is bibliotherapy, with biblion meaning book, therapia meaning healing in Greek. Bibliotherapy is simply about reading for its health-giving benefits. The idea is as old as ancient Greece and ancient Egypt. And the term was first coined in a newspaper article about 100 years ago. It was about a fictitious GP. It was written up in a story to try and explain this whole reading therapy idea. And bibliotherapy really developed and matured with collaborations between doctors and librarians during World War I. And it came to prominence for a time as a valid therapy, both at the front lines and in hospitals. Libraries sent millions of books to the front lines, and they tailored selections where they could for fiction, non-fiction, and magazines. And the importance of reading to morale was recognised to such an extent that some regiments even attempted to locate little printing presses and make their own little magazines or newsletters with comics and stories. I recently read a novel called The Paris Library based on a true story. And these librarians alone delivered over 2 million books to soldiers during both World Wars. And they hand-delivered books to Jews in Nazi-occupied Paris in World War II. Such was the benefit that was associated with reading. And of particular relevance to us is thinking about the soldiers in the hospitals. So they might have had 150 soldiers in one ward, and they were all in pain, they had no privacy, their spirits were low. And the librarians made sure they had books because reading offered an escape. It gave them something else to think about. They called it a privacy of the mind. So in these intervening years to the present day, bibliotherapy has been used in a variety of ways in hospitals, in libraries, and in schools. And it's been used to help both adults and children. It's widely known in the UK. It's even national policy in Wales, but it is little known in Australia. So bibliotherapy has been studied during the last 2 decades. Studies indicate benefits to all these mental health conditions, as well as to chronic pain, which is of particular interest to us, and to sleep problems. Okay, so this idea of telling stories and listening rather than reading to yourself. People have been telling each other stories for eons. This need to communicate stories is embedded in us. It's part of our very fabric of human connection. As we know, oral storytelling is part of cultural traditions around the world. And prior to the late 17th century, reading was actually a social activity. Books were read aloud rather than silently. Adult story times exist or have been trialled in a handful of libraries around the globe, including at Melbourne's library at the Dock. And I was lucky enough to hear a librarian speak at a conference about this. And she spoke of a lady who used to come down to Melbourne for her cancer treatment at the Peter Mac Cancer Centre. She was a regular attendee at these sessions, and she was also a lady who had lost her ability to focus on her own reading because of her treatment. But she came to every session when she was in Melbourne because she loved it She felt that she could sit and relax and listen to the story and take it in and enjoy it. And hearing this was an important piece of this whole puzzle as the idea for my research grew. So thinking about different parts of the brain and the fact that the temporal lobe, these side bits, aren't as affected in CRCI as the frontal lobe. And we know some people remember a story told to them for much longer than a story that they read to themselves. This has been shown, for instance, in people with dyslexia. So reading aloud offers a human connection. It's more accessible than reading to yourself when you have cancer-related cognitive impairment. So integrative therapy or holistic cancer care includes lots of evidence-based complementary therapies. It's unclear from literature how often bibliotherapy is made available as one of these treatments for cancer patients. It's not found on any of the websites for Australian cancer centres. And from my experience, I've never seen it as an option. But like art therapy and music therapy, it would be really good to see it included. So we connect to stories and to storytelling. We know that reading is beneficial, whether it's for pleasure or for learning. And we know reading can be impacted by the cognitive side effects of cancer and its treatments. So my research is attempting to reconnect people and stories and reclaim the benefits of reading in the process. I still need more participants too for my research. So if you live in Adelaide, we'd love to come and read to you, or you live in the country, or if you live interstate, and I don't have a reading volunteer near you, we'd still love to read to you. We can use Zoom to read. So please get in touch with me if you'd like to participate or if you'd just like to find out more. Thank you very much for listening. Any questions? My contact details are on the screen, so please get in touch if you'd like to know more.
Thank you so much, Elizabeth. It is a really, really interesting topic. And thanks for sharing and informing us about your research.
Thank you.
So we do have a few questions. So Daniel asks, wouldn't lack of good regular sleep due to steroids and general stress also be a significant contributor to CICI? Absolutely.
I mentioned distress, but yes, stress. And as we know, lack of sleep, that was a torture during the war, sleep deprivation. So I agree 100%, Dan. It's not going to help you at all, lack of sleep. Maybe, yeah, give us a call. We'll come read to you instead. You can doze off while we read.
Okay, look, thank you. I just wondered myself, this is such an interesting topic. Elizabeth, and you say that you're a cancer survivor. Did you notice this yourself? I mean, how did you go through this yourself when you had cancer, or did other people tell you, or how did that?
That's a great question though. So the first person I saw this in was actually my mum. She had a very rare cancer and she was hit with a lot of different types of treatments because it was so rare. It wasn't really known what to do. And she was the first person I ever encountered who lost this ability to read. It was some years later I went through my own cancer journey, and I must admit I was very lucky to not have chemo because, as we said, chemo is the most common way to get this. So I actually didn't notice it in myself, unless it's just my general disorganization, because I have sticky notes and diaries and I do write things down. That could be just that or my personality type, I'm not sure. So I was still reading through my treatment, but I've seen so many people that can't, that I formed this pattern. But as I said, I didn't have chemotherapy or targeted therapy or immunotherapy. Yeah.
Okay, thank you. No, it's really interesting. Tina asks, are there specific foods that could help?
Couldn't tell you, Tina. I do have a colleague at uni who was looking at diet and CRCI, and his research found it wasn't so much the foods, it was the CRCI impacting the ability to comprehend recipes for healthy cooking and healthy eating. So again, it comes back to the reading thing and the focus and the concentration. So I found that people were maybe not eating as well as they normally would going through CRCI rather than specific foods.
Okay, yeah, no, interesting. Look, this is a couple of questions in one. So are there particular websites that health professionals can go to do cognitive training or cognitive exercises?
It would be, but that's beyond the scope of my research. I know there are cognitive rehabilitation programs. I'm not sure if they're in Australia, actually. That would be psychology. Yeah, psychologists would know that one. Yeah, sorry. Yeah.
No, that's fine. Thank you. And just one last one that I have. So if you're exploring something like art therapy as a form of mindfulness, can that also help to improve cognition?
Nobody's measured it improving cognition. They've measured it in terms of overall well-being, in terms of making you feel better, which is very important. You know, it's not to be underestimated. So art therapy studies, just like music therapy studies, poetry therapy, you know, our study, there are some standard well-being questionnaires that you implement at the start of a program and at the end of a program, and you measure the difference. And studies around art therapy and music therapy have found, yes, people are feeling better through doing these programs. So it's the hope that bibliotherapy will have a similar effect.
Lovely. That's lovely. Look, thanks again, Elizabeth. It really has been terrific to have you here.